Case management of Marburg virus disease. Ethiopian Public Health Institute outlines principles of case management, screening and triage, diagnosis of Marburg virus disease, isolation and referral, management of suspected and confirmed MVD patients. Principles of management: ensuring safety and dignity, separate care unit for biosafety and patient privacy, implement IPC measures, maintain patient confidentiality, safe patient transport and burial, respecting funeral customs, psychosocial support for patients, families and healthcare workers. Principles continued. Establishment of triage and an isolation area. Establish referral pathways, including organization of safe transport or referral of the patient from their home. Performance of safe burials, respecting funeral customs and rights. Appropriate psychosocial support for healthcare workers, patients, their families, and their communities. Screening and triage. Screening conducted at facility entrance. Interview on symptoms, contact history, and body temperature check. Use Marburg screening form to assess for probable or suspect case. Maintain distance between patient and screener. Wear protective equipment. Diagnosis of MVD1 or Marburg virus disease. Diagnosis based on exposure history, clinical assessment, laboratory investigations. Use standard case definitions for suspect, probable, and confirmed case. Isolation and referral. Isolate suspected, probable, and confirmed case to prevent disease spread. Designated isolation areas with restricted access and proper ventilation. Trained health workers and ambulances for safe patient referral. Management of suspected and confirmed Marburg virus disease patients. Supportive care, hydration, electrolyte balance, anti-pain and anti-emetic treatment. Empiric treatments with antimalarials and antibiotics as necessary. Monitoring and symptom management, pain control, respiratory distress, dehydration management, and psychosocial support. Symptoms management table. Symptoms: fever greater than 38 degrees centigrade. Give paracetamol. Avoid NSAID. Acute bleeding, transfusion of fresh whole blood or components. Pain treatment: paracetamol, tramadol, morphine. Breathing difficulties, oxygen therapy. Diarrhea or vomiting, rehydration, antiemetics. Managing complications. Complications may include hemorrhagic fever signs, multi-system organ failure, shock, continuous monitoring of vital signs, input or output, and laboratory values, fluid resuscitation for hypovolemia with lactated fingers solution. Key components of optimized supportive care. Key points: systematic patient assessments and frequent monitoring, fluid resuscitation for dehydration and shock, management of glucose level and electrolyte imbalance, treatment of potential co-infections, and nutritional support. Shock management. Cause of shock in Marburg virus disease: gastrointestinal loss or GI loss, that means vomiting, diarrhea, septic shock, hemorrhagic shock. Follow clinical guidelines for fluid resuscitation. Targets: HR, urine output, PP, individualized fluid needs based on GI loss. Managing shock: be cautious with rapid fluid resuscitation in children in the following cases. First, severe acute malnutrition, SAM, anemia, HP less than 50 gram per L, severe dehydration. Hydration and electrolyte management. Hydration targets: heart rate less than 100 bpm, urine output greater than 30 ml per hour, SCBP or systolic blood pressure greater than 90, capillary refill less than 3 seconds. Electrolyte management: avoid critical abnormalities, that means arrhythmia, seizures. Manage glucose levels to prevent hypoglycemia. Preparation and administration of vasopressors. Follow this chart, please. Conclusion: Marburg virus disease management key points. Prioritize patient safety, privacy and psychosocial support. Comprehensive screening, isolation and referral pathways. Focus on supportive care. Symptom management and monitoring. Adherence to clinical guidelines for effective case management.